In this video, we will go over a nursing case study. Since the new generation Nclex will implement a 6-layer clinical judgment model to prepare students for real-world medical scenarios, this case study is a great practice tool. All answers will be at the end of the video, so be sure to write them down as you go. Now let's begin. Mr. Jacob Miles, a 25-year-old male, is brought to the emergency department by his family due to concerning behaviors. His parents report that Jacob has become increasingly withdrawn, exhibits poor hygiene, and speaks about hearing voices telling him that he is in danger. He has difficulty concentrating, exhibits disorganized speech, and becomes agitated when they ask him about his well-being. He has no history of substance use or significant medical problems. Jacob is diagnosed with schizophrenia spectrum disorder. Background information: age 25, presenting symptoms: auditory hallucinations, social withdrawal, disorganized speech, and poor hygiene. Family history: maternal aunt with schizophrenia. Current medications: none. Question 1. Which symptom is considered a positive symptom of schizophrenia? A. Flat affect. B. Hallucinations. C. Social withdrawal. D. Anhedonia. Question 2. Which nursing interventions are appropriate for Jacob during the acute phase of schizophrenia? A. Establish a trusting relationship with the patient. B. Encourage the patient to participate in group therapy immediately. C. Monitor the patient's safety and risk of harm to self or others. D. Use clear, concise communication. E. Validate the patient's hallucinations to build rapport. Question 3. Antipsychotic medications help manage symptoms of schizophrenia by blocking blank receptors in the brain. Question 4. Jacob is started on risperidone, 2 mg daily. After 2 weeks, he reports significant improvement in hallucinations but complains of restlessness and inability to sit still. What is the likely cause of this side effect? A. Akathisia. B. Tardive dyskinesia. C. Neuroleptic malignant syndrome. D. Dystonia. Question 5. Match the following risk factors with schizophrenia. A. Family history of schizophrenia. B. Prenatal exposure to infection. C. Advanced paternal age. D. Cannabis use during adolescence. Question 6. Jacob tells the nurse, "The voices are telling me I'm worthless." What is the nurse's priority response? A. Ignore the voices. They aren't real. B. Let's talk about how you're feeling right now. C. Do you believe the voices might harm you? D. Try listening to music to distract yourself. Question 7. True or false? Cognitive impairment, such as difficulty with attention and memory, is a hallmark of schizophrenia. Question 8. Identify the neurotransmitter most commonly associated with schizophrenia on the diagram of the brain. Question 9. Which medication might be prescribed to treat Jacob's akathisia? Is it A. Benztropine, B. lorazepam, C. propranolol, or D. clozapine? Question 10. What should the nurse include in discharge teaching for Jacob and his family? A. The importance of medication adherence to prevent relapse. B. Avoiding all physical activity to reduce agitation. C. Encouraging isolation during episodes of hallucinations. D. Stopping medication immediately if side effects occur. Let's see how you did. Let's now go over the answers. Question 1. Which symptom is considered a positive symptom of schizophrenia? The answer is B. Hallucinations. Positive symptoms include hallucinations, delusions, and disorganized speech or behavior. Negative symptoms include flat affect, social withdrawal, and anhedonia. Question 2. The answer is A, C, D. Building trust, ensuring safety, and clear communication are key. Encouraging group therapy or validating hallucinations is inappropriate in the acute phase. Question 3. The answer is dopamine. Antipsychotics primarily work by blocking dopamine receptors to reduce positive symptoms such as hallucinations and delusions. Question 4. The answer is A. Akathisia. Akathisia is a common side effect of antipsychotic medications, characterized by restlessness and difficulty staying still. Question 5. The answer is that they are all correct. Genetics, prenatal exposure, paternal age, and cannabis use are all associated with an increased risk of developing schizophrenia. Question 6. The answer is C. Do you believe the voices might harm you? Assessing safety is the priority. If the hallucinations are commanding self-harm or harm to others, immediate intervention is required. Question 7. True or false? Cognitive impairment, such as difficulty with attention and memory, is a hallmark of schizophrenia. The answer is true. Cognitive symptoms, including problems with attention, memory, and executive functioning, are common in schizophrenia and significantly impact daily life. Question 8. The answer is schizophrenia is primarily linked to dopamine dysregulation in the brain. Question 9. The answer is C. Propranolol. Propranolol, a beta blocker, is often used to manage akathisia caused by antipsychotics. Question 10. The answer is A. The importance of medication adherence to prevent relapse. Adherence to prescribed treatment is critical to managing schizophrenia and reducing the risk of relapse. Alright, well that ends this video. If you found this video useful, leave a like, a comment, and subscribe so we can make more videos like this.